Good evening, and welcome to tonight's meeting of the Commonwealth Club of California. I'm Ken Stram. I'm the director of the San Francisco LGBT Community Center's Economic Development Program, and I'm your moderator for tonight's program. I'd like to acknowledge Damian Quisnell and Tito Vandermeiden for their contribution and expertise in helping to put this program together tonight. Tonight, the Commonwealth Club of California is delighted to present the demographics of LGBT people living in the San Francisco Bay Area. Why does it matter? In our market-driven culture, if you can't count something, it's as though it doesn't exist. And there isn't a checkbox for LGBT on the census form, so if you can't count LGBT people, do we exist? This program will address the challenges of getting accurate LGBT demographics. And our experts tonight will discuss how public policies, programs, funding decisions, and corporate marketing strategies all rely on the assessment of how many LGBT people there are and where they are. Our speakers tonight include Gary Gates, Ph.D., a senior research fellow at the Williams Institute of UCLA. Gary Gates, Ph.D., co-authored the Gay and Lesbian Atlas. His doctoral dissertation included the first significant research study of the demography of gay and lesbian population using U.S. Census data. His work on that subject has been featured in many national and international media outlets. He's also co-author of a study examining the interplay of diversity in the location and growth of the technology sector. He holds a Ph.D. in public policy from the Heinz School of Public Policy and Management at Carnegie Mellon University, along with a Master's of Divinity degree from St. Vincent College and a B.S. in Computer Science from the University of Pittsburgh-Johnstown. Also joining us is Willie McFarland. Willie McFarland, MD, Ph.D., MPH, is co-director of the HIV Epidemiology section of the San Francisco Department of Public Health, DPH, and Associate Professor of Epidemiology and Biostatistics at the University of California, San Francisco. His responsibilities for the DPH include tracking the course of the HIV/AIDS epidemic and providing data used for HIV prevention and care program planning and policy decision-making. His primary research interest is in sampling and surveying hidden and hard-to-reach populations at risk for HIV and STD. Through UCSF, Dr. McFarland provides consultation to international agencies and ministries of health worldwide on HIV serological and behavioral surveillance. And last but not least, we have Jerry McHugh. Jerry McHugh is a senior research director with Community Marketing, Inc. Jerry's been with community marketing since 1999. As senior research director, Jerry is the chief architect and analyst for Community Marketing's LGBT Consumer Index, the annual Gay and Lesbian Tourism Study, and numerous custom studies for a wide variety of clients. Community Marketing has analyzed more than 50,000 survey responses from lesbians and gay men in the last 12 months. Prior to joining the CMI team, Jerry owned and operated one of the largest gay-dedicated travel agencies in the United States. I'd like to remind our listening audience that this is a program of the Commonwealth Club of California titled The Demographics of LGBT People Living in San Francisco Bay Area. Why does it matter? I'm Ken Stram. I'm the director of the San Francisco LGBT Community Center's Economic Development Department, and I'm your moderator for tonight's program. So we're going to begin with one question for each speaker, and then we'll ask some follow-up questions. And again, remember that about 40 minutes into the program, we'll take questions from the audience. So my first question is for Gary Gates. Gary, what do people think they know about the LGBT population, and how is the data valuable in countering many of the stereotypes people hold about the community? And also, what are some of the shortcomings of that data?
By and large, I think the media images of gay and lesbian people tend to be predominantly white, actually predominantly male, and predominantly urban, and because of that, predominantly wealthy. And so, and basically, you're talking about the Will and Grace model of gayness. And even organizations like GLAAD, the Gay and Lesbian Alliance Against Defamation, they've actually done media studies, and they show that predominantly these are the images shown across a wide variety of media. And so I think that those are the images most often that people have in their minds when they think about gay and lesbian people. And of course, most of those things are largely untrue when we look at data where we can get information from a more representative sample. So in my case, I've done a lot of work looking at census data, which is a way that we can count same-sex couples, and these are couples who are not simply roommates. They've either called one of the persons their spouse or their unmarried partner. And obviously, one huge advantage of census is that you have an enormous data set across a wide variety of geographies. And so one thing you realize is that, good Lord, you know, there are same-sex couples in 99.7% of U.S. counties in 2000. So basically, you know, shock of all shocks, gay people are everywhere. And that might sound sort of facetious to say that, but in truth, census provided the first empirical evidence of that being the case. I mean, prior to census, no one actually had a study that they could legitimately say that. And but when you find that, then you find that, oh, you know, not in addition to them being everywhere, it means that some of them are actually quite poor, that some of them, a lot of them are non-white, and one of the biggest things is that particularly for same-sex couples raising kids, they're at enormous economic disadvantage. So one of my favorite lines from the census data is that the state where same-sex couples are most likely to be raising children is Mississippi. And if you look at the states where same-sex couples are most likely to have children, they're predominantly throughout the South, and they are largely not where gay people live, or at least where we historically think about gay enclaves. They're basically where other people have kids, where people who have a lot of children live. And another, you know, when we look at economic studies of gay people, we find one of the most persistent findings, not just with census data, but with all kind of data, is that gay men, on average, earn less than other men. It's in almost every study that's been done shows that. And yet, there's this persistent notion that gay men are wealthy. Now, there's some validity to that notion in the sense that gay men are a lot less likely to have children, so they can spend their money differently than heterosexual men, who often have to devote their resources to kids and to college and that kind of thing. But nonetheless, when we look at just wages, and even when we sort of consider occupation and other education and other factors, they're less likely to, they have actually lower incomes. So, so those are just a few of the things that I found, and I think to close, one of the things that I think is important is that there are very few surveys that actually ask sexual orientation, and so getting at these issues can be very, very difficult. And so as gay people do become more visible, more willing to answer questions around sexual orientation on surveys, we're discovering that the kind of visible gay population is perhaps much more diverse and much more counter to many of our stereotypes than we think.
Thank you. And Dr. McFarland, how many LGBT people do you think there are living in San Francisco? How did you get to that number? And very basically, what is the methodology that you use to arrive at that number?
Well, the short answer is 84,888. Can I stop there? Actually, I mean, first of all, the thing that struck my attention was that your number with a totally different methodology was spot on.
Yeah.
And I think we're both sharing the reassurance because we are trying new techniques and new methodologies, and we have no gold standard to compare it to come up with these numbers. So when two independent researchers doing two different methodologies come up with something so astonishingly similar, it reassures us that we're on the right track and probably in the right ballpark. But let me just break that number down a little bit. That gets a little harder and a little more imprecise. Within this, we think 63,577 are men who have sex with men. One difference might be we try to define it behaviorally, not by gay or bisexual identity. So it's trying to be a bit more inclusive than that. In the event, though, about 10% we estimate identify as bisexual or have had sex with both men and women in the last year. This includes 18,800 women who have sex with women, again, independent of the identity. An additional 1,883 male to female transgendered persons. Now, when we get to this point, it's getting really difficult to get a handle on these numbers. That one's very difficult. And then even more tentatively, 628 female to male transgendered persons. So that's the total 84,888. Just to qualify that a little bit, this number is taken, or we create it from the perspective of HIV prevention and care planning. So it's very much the perspective of the community we're serving at risk for HIV. And it may be very different than when we're looking at other issues around economics and household, other household factors or demographics.